was a Cutera Genesis booth, and looked very impressive. Guy was in an Italian suit. Jody Schoenhaus was there speaking on it. It looked very impressive, and they had these amazing results. And I didn't think I was going to get one at the time, but I eventually did. Now, was it game-changing in terms of economically? Yes. Was it game-changing in terms of the best thing since sliced bread for onychomycosis? I'd have to say no. Does it have a role as an adjunct? I think so. So what I'm going to be talking about today is how can we bring these technologies into our practice, which are sometimes dubious in terms of data. Gotta get the clicker here. So this is my Q-scan. Where's the button on this baby? Oh, this is okay. Let me go back a step. So, technology, does anybody recognize this picture? I have to go to the mic, this thing keeps bouncing off. Does anybody recognize this? It's in each one of our rooms. This is the Virginia Beach layout, way back at the turn of the century. The turn of the century, they had a rail that pulled right up to the Cavalier. It was a big deal when they went to a gas-powered rail. So this was the luxury train that brought you right to the Cavalier. Back then, people stayed for like a month. Here we're staying for a long weekend. So today, technology is changing by the nanosecond. So you really have to keep up with the literature, do your due diligence, try and find out as much information you can from PubMed, etc. Take what the reps have to say with a grain of salt. This is a slide that references a study, or not a study, a philosophy that Luke Cicconelli came with. He was a year ahead of me at school. He said that outcomes are based on, in the numerator, science times the experience times F. F is the surgical skill elasticity coefficient of the surgeon, divided by expectations. I think you can say the same thing about these new technologies. If we look at F as what's inside that box. So we're looking at arthritis, tendon, ligament, muscle degeneration, diabetes, post-surgical structural changes, neuropathy. We're looking at functional movement patterns, the Venn diagram crossover between speed, agility, balance, proprioception, muscle endurance, and healing. The data funnel, we've got all kinds of data, evidence-based medicine, anecdotal data. We get data from our patients. A lot of this depends on constructing a paradigm that makes sense for your patient and makes sense for what you want to do with your practice. And then you have to pick the path that you want to pull. Now, one quote that I wanted to share about some of these technologies, just a general thing. This is something Mark Dollar told me that he got from Orthopedics Georgetown chief. When surfing, catch the second wave so that you're able to see where the first wave crashed from an unknown hazard. So some of us want to stay on the sidelines the whole time. I think there's a balance between giving technology a little bit of time, but let's remember, real science involves repeated trials. So if you get one trial, depending on how that trial was shaped, let me give you an example. There was a regenerative medicine trial that had two arms. The first arm it was a plantar fasciitis outcome trial. The first trial had people doing stretching and some basic, I think, lifts in the study. The second trial involved the regenerative medicine arm plus those other things. So how can we say from the end truly, even though I believe in some of these regenerative options such as placenta tissue, which I'll talk about briefly, how can we say what the true end point was when we were doing all those other things? So, and is the differential in terms of, we can say like 60-70% got better, is the differential between the two arms, how much of that is placebo? All right, I'm going to change tracks a little bit. One of the other technology things that's impressed me lately, and I just brought this into my practice, is 3D printing. With the COVID delays with shipping and some of the things that have happened in labs with split shifts, this is a great thing to bring in your practice. You can get these for roughly $2,500 and you pay about a $15 per scan fee. So the cost of your orthotic, once you put the initial lay down, is about $15 for the scan, plus about $6 or $7 for the TPU that you spit out. And they can do all sorts of things. You can make little widgets, little heel wedges, different things. 4D printing, this is something that the shoe companies do. That's in a gel matrix as opposed to an additive print. An additive print just means a stack up from the ground. So with 4D printing, you're doing it in a gel matrix where you're getting a triangulation and then making your device. The one thing that you have to reckon with all these in-office printing is that you're going to have to like to be a technician to some degree, because you're going to recognize certain materials work better, certain TPUs work better. Sometimes you're going to have a problem with the nozzle. You know, usually they're pretty good about supporting you. I had my company send me a nozzle when my thing clogged up, rather than having to wait and delay. All right, so what other new things are available? We've all seen Frank Netter's drawings. You can now show your patient these wonderful anatomy apps. Some of them you have to pay for, some of them you get a free trial, some of them are available free. These are all also integrated into some of the high-end multi-purpose shockwave units. So it's really impressive in terms of educating the patient. I know that Dr. Joel Morris has a unit that has these kind of capabilities, and you see this sort of Michelangelo drawing, and patients eat this stuff up. I want to talk a little bit about ultrasound. You know, from 20 years ago, these technologies have gotten even better, mainly the stuff inside the box, in terms of canceling out the white noise so we get even sharper images. We don't worry about it as much, but from the work outflow standpoint with the vascular interventionalists, they now have much better workflow improvements to get you through those layers of the study without having to go bounce between different things that you had to tag. Now they have the protocols sort of built in. So they become more cost effective. It always puzzles me why we still don't see these more on the athletic field, you know, getting back to sports medicine. To me, I can get a very good idea of an Achilles tear, and yet, you know, even at the football stadiums, you're seeing patients running, or the players run into the locker room where they happen to have, if that stadium happens to have an MRI, which is a static study, you can really get the slices. So I think ultrasound should be utilized more by our profession in particular. This is something that I picked up just the last year and a half. This is something John Cosarelli taught me, which is the double contour sign in gout. So you get this refractory effect of the crystals and the beam bouncing off the gout crystals. Looks like a double rainbow. You can see this also sometimes on the heel. Sometimes I had one that had gout in the knee, and I had a refractory off the patella. All right, so some of these therapies that people are doing, regenerative therapies, are based on the age of the patient. So for a 73-year-old level 3 teacher, are you going to want to do platelet-rich plasma for him? I don't think so. I did amnion in this particular case, and I was able to repair his tear with that, and then I also used a series of shockwave treatments. By the way, I started believing in placenta when I injected my own Achilles. I got so far with the shockwave treatments. I have a radial unit in my office, and then I did one amnion injection, and that helped me. It wasn't tweaking anymore. I think that these therapies do better for tendon and muscle injuries than they do for joint. I think fibrocartilage is difficult to expect, and that's why I don't think we're really seeing great successes in these knee, ankle things with shockwave. You may get temporary relief, and then things like medial tibial stress syndrome are a different ball of wax because that's not a joint. So I do believe that these technologies, as I'll talk about further, can help with that bone edema. This is just a before and after of this patient's Achilles. So regenerative medicine, of the four here, I like amnion the best. Stem cells are great, but they're also the most expensive to harvest. PRP is age dependent. Exosomes I don't think have really borne out, and then there's a company that got the current onslaught of clawbacks because of safety issues. And there's been more than one company, by the way, so it's not just confined to exosomes, that didn't have the proper lab standards, that then also led to other things happening with clawbacks that we're seeing on indicated use. And that's something that we're still reckoning with. It's interesting, I just had a Zoom talk with a company that was saying, warning about the fact of giving some type of rebate, which is sort of a no-no, because Medicare, for instance, wants to see maybe a 4 to 6% overage on that pricing. So when we get all these other things, they have to be factored in. And Paul Kesselman, I talked with him, was just talking to me about that and reiterated. So what this company was doing is they were changing the sort of the paradigm, saying we're not going to be a growth factor, we're going to fill a deficit. And so now we're changing the language. We got a different sort of connection with CMS. And then what they were also doing is saying we're going to pay you as a consultant. But you're being paid as a consultant not because of your particular expertise, just because you're happening to use the product in the study. So I think that's a little fraught with concern. So when you see those things, I think you have to have the Danger Will Robinson bells ring in your head. There's some other things that are happening in the rehab world where everybody's talking about eccentric, concentric contractions. I just saw something sort of saying that eccentric is not always helpful too. So there's a lot of confounding studies. You really got to keep up with this stuff, and I would encourage you not just to look at what's out in the podiatry literature, but look what some of these strength coaches are doing at the NFL Combine. You'll find a lot of good muscle and tendon and strength information. Kinetics versus kinematics. I just wanted to comment briefly that we get so preoccupied in what we see in the frontal plane, and that's what also we see in the run stores. That everything is frontal plane. We have much more excursion and motion occurring in the sagittal plane. The other thing I want to say is that it takes a lot of effort to even get 1 or 2 degrees, whether it be an orthotic or a brace, in the frontal plane. Where the rubber meets the road is really in the kinetics or the torques within the joint. So you can have only a couple degrees of visual change by your orthotic. And these are also, by the way, at very high angles. So 4 degrees may not be enough. You may need to go to a lake inverted at 25 degrees to really get 2 or 3 degrees of visual change. But the kinetics, the torques inside the joint are the most important thing. Shockwave therapy become very popular. There were once $500,000 units. Now we can do these in the office. This is a radial unit, probably about 20 to 30K. There's Korean knockoffs that you can get for less. You have to do your due diligence about comparing things like a company like Stores to some of those knockoff units, and again, see where the value is. What I will say about once you, all right, so let's first take a look at what these are treating. These are probably the top 7. And for my own situation, I have a meniscus tear that I had shaved off, so I still have a little bit of arthritis in that knee. So I've treated with Shockwave runner's knee, my own, and Achilles tendonitis, mine and my patient, hamstring issues, my own and my patient's, plantar fasciitis, my own, shin splints, my patients, ITB, I've had patients with ITB, and stress fractures. All these things, focal is obviously going to work better for a stress fracture because it's got a higher intensity and it triangulates. Focal produces cavitation, radial produces pressure waves, so they're different. This is just a homemade you can use. I think homemades are important. This is an oscillating ball called the Meteor ball. It's got oscillations, nothing to do with shock. It produces heat. I think anything that we do that a patient will use is a good thing. So if they're not going to take the time to do the ball and the ice, why not just put it in one thing and have one-stop shopping? These I carry in my office. We just dispense them to patients at the same price that they would find on Amazon. PMF. This has become both a multi-marketing thing, but it also has some validity. We're still waiting for better studies on these, but there's a big difference between getting a $1,000 unit that a company like Omni has versus some of these $5,000, $6,000 units. You really have to do the science because some of it, again, is just projection with marketing. EMMT, this is a stores device. So this is supposedly the Cadillac of the industry with electromagnetic transduction. It's something new that most of us are not familiar with, but it is going to have a role. I got a study that I just was looking at this morning. Ludger is his first name. He does all that stuff over in Germany and Switzerland. They're way ahead of us in Europe with this stuff, with both shockwave and electromagnetic transduction. Why? Because they don't emphasize surgery, at least in some of the countries, quite as much as we do. So they are really pushing towards these therapies. So they had some level 2A evidence with low back, and then there was also in Journal of Foot and Ankle Surgery in 2017, Ludger also authored a study, he's an orthopedic surgeon, on Achilles tendonitis, and that showed some statistical significance. But again, he mentioned himself, you got to look at the difference between the placebo effect. And so these things, I think, are going to continue to grow in terms of their use with sports medicine in particular, as people want a fast option, although these are several treatments. This isn't a one and done. That study was 8 treatments that I mentioned with the Achilles tendonitis. This is what a knockoff is. So you're talking on the former about 40K. This knockoff is about 14K. This does about 0.4 Tesla. The other one does, depending on what platform, between 0.6 and 0.8 Tesla, which translates to Gauss. So, if you're asking me what's the difference between 0.4 and 0.6 Tesla, I can't answer that. Most of these companies aren't going to put head-to-head competition. What they will do is they will scare the fear of God that if you order this unit, you are going to be wishing you got the other unit. So, but we don't know that. So you really have to kind of, as much as you can, try to go through the experiences of trusted practitioners that you may have association with, or find practitioners that have had experience with these that you feel are just a shield for the company. This is what they look like with the foot. I love this because it's unattended. To me, the MLS was the biggest fraud. Well, I wouldn't say fraud. It's a class 4 laser, so it is doing something. But you're paying upwards of $30,000, $40,000 for a robot just because it's moving back and forth. Why not just have something stationary and put, and this is a totally different platform. This is electromagnetic transduction, different than low infrared light or laser. Totally different. Magnetic waves. But why not have something that's stationary instead of moving around the foot and putting your money there with something that's really doing something? I would say a class 4 laser is probably hardly much more than what you're going to be able to purchase on Amazon for about $800. All right, so is the bang worth the buck? You know, so we're in diminishing returns. Michael Downing was telling me that they're getting for Charcot sometimes less than bunion surgery for the Charcot reconstructions, where multiple revisions and blah blah blah. We know, and he's telling me that in his healthcare system, and I've seen this with United, we're getting $440 versus getting $200 for a focal shockwave. I'm not saying don't do your bunion surgery, but at the end of the day, as inflation is kicking around 8-9%, if we want to be able to enjoy and have a retirement and do other things, we have to look at the balance. So for me, personally, I'm going to have to take a long, hard look before I'm going to spend 40, 50K, but I also want to know if something in the 15 to 25K range is going to be effective. And I want to present it as such to my patients. So I think it's important to be transparent with our patients. All right, anybody remember this picture? So what I want to leave you with, I guess one message is do your due diligence. If you're going to ride the wave, know that some of those waves aren't going to pan out. But if you don't get on the wave, you may miss an opportunity where everybody and their brother, and you could then establish yourself as the guy in the area to do a particular treatment. This is my email if you have questions afterwards. I have a podcast, Fitfoot U. It's both Apple, Spotify. It's also on YouTube, so some of them are visual. I've talked with different disciplines, particularly some of the new stuff that I wasn't familiar with, the PMF, the electromagnetic transduction. I'm going to have, I just saw Dr. Downey here at the conference, and he's going to be doing a promo for his conference in September at the school at Temple. They're doing a Podiatry Institute meeting where they're going to compare, I guess they're going to have this great debate between the old school guys, Michael Downey, Scott Millay, and the quote, new old school with Tom Chang, Luke Cicconelli, and some of those guys. So Alan Block's going to moderate that. Sounds like it's going to be fun. We're going to be talking about some different philosophies. Any questions? If no questions, and you have questions later, feel free to contact me. Thank you.